This is Fahr's disease, presented by Stacy Spitzer, Marissa Smith, Zach Compton, and Sylvia Flores.
Hi, I'm Dr. Smith.
Hey, I'm Zach.
How are you today?
I'm doing pretty well.
That's good. So what brings you in?
I've just noticed some changes lately. I've been a little more clumsy than normal. I've had some muscle cramps, and I've had several headaches.
Okay. And I'm also noticing the slight tremor in your hand.
Oh yeah. That's been here for a little while, but it just comes and goes. And it doesn't really bother me, and so I never thought it was anything that's serious.
Okay. Do you have any family history of any neuromuscular disorders like Parkinson's that might explain the tremor in your hand?
No, not that I can think of.
Okay. And with your headaches, you said that you'd also been clumsy as well. Do you have any recent falls that you could have hit your head on anything?
No, I haven't fallen.
Okay. I'd like to do some blood work
Okay.
to just make sure everything's normal.
Right.
And I'd also like to do a CT to rule out any sort of neurological disorders.
Okay.
So we'll get that done and then we'll regroup and go from there.
That sounds good.
Okay, so your CT results are back. So right here, this large white spot in your brain, that's called calcification. It's just high levels of calcium. And it's right on top of your basal ganglia, which concerns me because your basal ganglia is responsible for your fine motor movements. So just basically walking, anything skilled like that, which probably explains your clumsiness.
Okay.
Because what a normal brain looks like this right here, there's none of the white spots, it just all looks pretty normal.
Okay.
So the amount of white spots that I see here in your brain concerns me.
Right.
So what this could be, what I would assume it would have been Parkinson's because of the tremors and the headaches and whatnot. But since you have such the high levels of calcification, it rules out Parkinson's. But it leads me to believe that it's a disease known as idiopathic basal ganglia calcification. It's also known as Fahr's disease. It's the more common name, a little bit easier to say. Which it entails all the symptoms you've described to me. And then it can also have things such as seizures, stiffness of the muscles, and eventually dementia. So you haven't really experienced any seizures or anything, correct?
No, just what I've told you today.
Okay.
So you said it was Fahr's disease, so what do we do what's the treatment for Fahr's disease?
Okay, the treatment course, unfortunately, there is no definite cure. There is research being done to find one, but as of right now, they haven't found anything.
Okay.
However, what I can do is we can prescribe medications to help treat the symptoms that you already have, like your headaches, the tremors, and the clumsiness. So for the tremors in your hands and a little bit of the clumsiness, I'm going to prescribe you some beta blockers. It'll just help keep those under control, lower the frequency of them. However, some side effects you might experience, some nausea or vomiting, that's normal, but if it's anything too severe, just give us a call. And then for your headaches and for seizures that might occur, I can prescribe you Topamax. Unfortunately, you might experience the numbness and your tingling in your hands. A lot of patients see that. It's fairly normal. You might also have loss of appetite, so just even though you might not have an appetite, just try to eat some things just to help keep your stomach settled, especially with the beta blockers, so you're not getting too nauseous. So do you have any other questions?
No, I have a question.
Okay.
You said that there was no treatment, so like, is this like, can I live a long life with this, or what's going to happen?
The progression is different for each patient. However, it is a degenerative disease, so it does slowly break your body down. So, but since the progression is so different per patient, we can't exactly pinpoint when these other systems will arise. So we'll just monitor you closely to make sure, if anything, we'll just keep you coming back a few times.
That sounds good.
So for now, I just want you to come back in about 6 to 8 weeks. We'll do another CT, some more blood work, check, adjust your medication levels if we need to. However, if you experience any symptoms that concern you, please call us and schedule us another appointment, and we'll go from there.
Okay, that sounds good. Thank you.
Thank you.